Hello, this is Dr. Tae, and today's episode is on Bilberry. There was a 2 week hiatus. One, it was my daughter's birthday, so we went out to Rhode Island, ate some good food, and came back. The other week, I just had to take care of some stuff on a Saturday, which is today. So we're back to our normal schedule. And today's episode is on Bilberry. And here is a picture of Bilberry. So on the left, the smaller berries are bilberry. On the right, this is everyone familiar with, blueberries. Bilberries is kind of hard to come by, so most people get it in some sort of supplement form, but it's a low growing shrub. So oftentimes you have to bend forward and pick up the blueberry looking things. And blueberries, they grow on shrub trees that grow like, up to maybe 4 feet, sometimes 5 feet I've seen it up to. But bilberries, they usually tend to be on the ground. The shrubs are much more lower, and that's how you're able to differentiate when you're walking out in the wild. They're prevalent in North America. I believe I was eating bilberries in Tennessee when I was hiking with a bunch of friends of mine. And that's when I first came across it. I thought I was eating blueberries. And then when I went home and looked it up, I was actually eating bilberries. They kind of taste similar. It does leave some sort of residue in your hands, so you got to be careful when you're eating them or picking them. They're kind of on the fragile side, so it does leave like stains. And blueberries are sweet with slight tartness. The skin is thin and smooth. Bilberries are more complex in flavor. They are sweet but sharper in the tanginess compared to the blueberries, and that's how you kind of like differentiate them. They're more sharp on the tanginess. The nutritional values for bilberries, it has a lot of vitamins and all that stuff, but once again, because the tanginess, what does it do? If it has a sour, bitter, it means anti-inflammatory, right? And it's got a lot of culinary uses, but I want to get to this over here. One of the unique factors of bilberries is that pilots during World War II has taken them to improve their vision and night vision. So it has something to do with the eyes. And does it have other effects? The answer is yes. It is anti-inflammatory, anti-cancerous, all of these things. Now, if you have cancer, if you're to eat bilberries, it's going to get rid of it. The answer is no. On the future video, I'll talk about how you go about treating cancer nutritionally. And once again, this is not medical advice. Please take this as a form of education and entertainment, not as medical advice. So please go talk to your doctor if you're suffering from illness and watching these videos. Is this, if this will be helpful or not. So I'm going to go over this study from the National Institute. So it talks about bilberries, some of the compounds in there, and the bilberry effects. The antioxidant effect is high in vitamin C. So some people have taken it to treat scurvy over the years. And over here it talks about genoprotective and anti-cancer effects. It could be one of the ingredients of the many things that you're doing to treat cancer, but this is not one of them. Cardioprotective effects. Yes, there is a anti-inflammatory effect, antioxidant effect, and that's good for that. The also, once again, anti-inflammatory effects, hypoglycemic. Once it's bitter, it has all of these effects, just like the way we've been talking about a lot of the herbs. Remember, the taste and temperature of whatever's of the herbs or berries or whatever you're consuming has a function in Eastern medicine. I guess the lesson I'm trying to promote to a lot of people, so that people understand the chi of the herbs and what does it do without knowing the actual effects. And this is how ancient people categorize herbs. Is this in relative to blueberries? This is more tart. So being more tart, it would have more of these effects. If it was more sweet, it would make you gain weight because it's sweeter, right? So instead of thinking, what does Google have to tell me about what these herbs do? Just simply by eating the herbs might give you a better effect in understanding them. This is the part that I really want to focus on, because what makes bilberry unique is that it has a long history. for use of disorders in the eye and promoting vision. And this is the focus of Bilberry. There have been numerous studies of the effects of bilberries on various aspects of vision and ocular disorders, including cataract, retinopathy, macular degeneration, and night vision. And all of these studies supporting have shown that positive effects, including improvement in retinal abnormalities, increased capillary resistance, showing of progression of lens opacity and myopia, and improved dark adaptation. For example, in a study of 50 patients with mild senile cataract, 4 months of supplementation with bilberry, anthocyanins plus vitamin E was reported to have a 97% success rate in preventing cataract progression. So what this means is that around the age of 50, taking bilberry on a consistent basis may prevent you from getting cataract surgery, because this does happen. Cataracts are this film around your eye, and it feels like you're losing a vision. So a long time ago, I don't know how they went about fixing this, but when my dad got it, we went to the hospital, and he had like a small eye surgery where they cut the lens out with laser, flap it open, take the film out, put a lens in there, and sew it back up with laser. And that helped my dad feel better overall. However, taking bilberry on a consistent basis may prevent those things. And one of the main functions why bilberry has good for ocular effects is that it's a vasodilator, meaning the blood vessel dilates so that the blood is able to flow through better, and therefore blood is able to reach the eye or any areas of tightness. And once again, for those people who practice yoga and things like that, doing neck stretches, I mean, stretching anywhere is good in the body, but doing a lot of neck stretches, especially in the scalenes, the SCM, the splenius capitis in the back, levator scapula, upper trapezius, all of these muscles around the neck, those are the neck muscles that I just described, stretching them and breathing into your maximum capacity would help a lot of the ocular effects, preventing strokes and things like that. Because in essence, you're taking into account for several things. When a baby is born, a baby's body is very warm and flexible, but towards the end of the life, a person's body is very cold and stiff. And stiffness or tightness in the body creates pressure on the blood vessels, and therefore it can create the eyes not to have proper circulation, therefore it degenerates faster. Or if it applies too much pressure on the brain, a blood vessel can pop and you can have a stroke, or it can create on your heart. So taking a vasodilator in these effects is good on a consistent basis. And I think the ocular effects is due to the fact that it is a mild vasodilator. One might say it's like an aspirin, like a baby aspirin. It keeps the blood thinning in a very small way. The other one is neuroprotective effects, the phenomenon of age-related degenerative diseases leading to cognitive decline, stroke, etc. The vasodilatory and anti-inflammatory effects of bilberry can be expected to have a significant effect in relation to the preservation of cognitive and neuromotor function through lowered risk of hemorrhagic and thrombotic strokes. Once again, the neuroprotective effects also is caused by the vasodilatory and anti-inflammatory effects of bilberry. So if you have issues like this, please take bilberry or try to find a supplement or the wild access of bilberry, and if you could forage them, that would be the best. So for more content like this, hit like, subscribe, and share videos like this. It's not just about bilberry I'm trying to teach, I'm actually trying to have a message. And coming up soon on October 25th, I am flying out to Mexico City, so I'll try to bring some footages back about my experience in Mexico City. I'm trying to connect with the market vendors who sell herbs, and if they have a farm, that would be the ideal situation want to go cultivate a relationship. And my goal is to bring two herbs back on the minimum. One is marigold, which I'll talk about in the future video, and a video that I did already in the past, which is hibiscus. All right, on that note, stay tuned for next week. Take care. Bye bye.